Hello everyone, I'm James Braithwaite, proprietor of Yorkville Physiotherapy. This is Celeste Shirley. Hi Celeste, who is the proprietor of the Yoga House here in Toronto. And we're just talking a little bit about Celeste's experience coming out of her surgery on her first metatarsal joint on her foot. And Celeste, you were just talking to me about some of the sensory experience that probably a lot of other people have coming out of their surgeries, and we thought it might be a good idea to sort of talk about that a little bit and give people some perspective on what they might experience coming out of a surgery too.
Yeah,
so,
yeah.
What was it that you were getting at there?
Well, I took the cast off 2 days ago, and when I touch the thumb, my thumb touches my toe, my very first touch is like, whoa, like it's like a blast of pins and needles. Really, if I was just upset, I'd say it's pain, but it's like strong sensation.
Yeah.
Now, if I didn't know that, I would say, wow, my foot is like, it's freezing.
It can be kind of scary, eh?
Yeah, and I can't sense it. I can't have a feel for it.
Yeah.
And I think if I really didn't understand, I'd feel queasy.
Yeah.
But because of all my yoga training and pain management and knowing how to do all that stuff, I've been able to touch it and go, okay, let's see if I can increase sensation through touch.
Yeah.
And that's made a huge difference.
Yeah.
But
You're bang on. Intuitively, you're really going to all the right stuff. Yeah, there's a real physiological reason for why people get that sort of sense of hypersensitivity coming out of surgery. Yeah, major injury, broken bones, sometimes people get this. It's called central sensitization, and what it means is that your brain can become oversensitized to the area of injury. The representation of that body part in your brain can become larger, and the threshold for detecting pain or the types of things that might cause pain change. All of these, and also you mentioned it feels really cold, right? That's another common symptom. People have difficulty with temperature sensation, right? So hypersensitivity, what might not have previously been a toxic sensation becoming a toxic sensation.
Yes,
so
yes.
what wasn't previously painful becomes painful,
Yes.
and then it feels really hot or really cold. Sometimes people get actual physical discoloration, abnormal swelling, that type of thing. Yeah. And it's something that we treat, honestly, very simply, just with tactile stimulation. Just stimulate, normalize it. You totally did do that too.
That's what I've been doing all week.
You went intuitively to the bang on the right thing. Like what I really recommend for this type of thing, and it's entirely common coming out of surgery, is get different types of textures, different kinds of temperatures, and just stimulate the area, right? So you might use something soft, right? Something that has some texture, like even like some what's the word? Like kitchen roll. What is that called? Like brawny.
Tea towel?
Brawny, or even a tea towel would be great.
Yeah.
Like with the roll of brawny or whatever, a piece of leather, some ice, or like for cold sensation, something a little bit warmer, like a hot pack for warm sensation. So different temperatures as well as different textures, and just stimulate it, like reintroduce it to what's normal, right? You just want to give it new normal. You want to re-normalize it, right?
Okay.
So just spend 20 minutes a couple times a day introducing it to new temperatures, new textures, and it'll settle down. And what you're experiencing is really entirely normal. And thanks for bringing that up, because it's something that we tend to forget about a lot. And it might freak you out if you didn't know any better, right?
Yeah, that's true.
Yeah,
it's true.
So try that one, and good technique. Okay.
Good,
Cheers.
thank you.
Yeah, no problem. Yeah.